One thing I would recommend from those that are just learning to do more aesthetic-based dentistry is do the dentistry when you're not stressed or rushed by other things going in your office. When I first started doing these cases, I did them on my day off. My dental assistant would come in. I didn't have hygiene checks. I didn't have another patient in an hour. I could do that. I could make money. I could take a bunch of photos and I could treat that case and spend the quality time that it needed on that case, right? If it took me 3 hours, it took me 3 hours and I got to go home early. If it took me 6 hours, there's not hygiene checks I have to make. There's not other patients that are waiting in the reception room that I'm behind 3 hours. Then what I did is once I realized I could get it in somewhere around 4 hours, then I could schedule it as an afternoon. So that's my only patient in the afternoon from 12 to 4. Then I'm not rushed. If I get done in 2.5 hours, I'm done early. If it takes me 5 hours, there's not other patients waiting. And then the more you do, the more you can say, okay, it takes me 2 to 3 hours, so let's just block it in 3 hours and we can stick it in any place in our schedule, right? The cost of doing business, obviously, what does it cost you for that restoration or smile design, right? How much do you need to make an hour and how many hours is it going to take you, right? I mean, part of it, the reason I did it on my day off is even if I didn't make any money, I loved it so much and I was learning so much and I was getting cases out there in my community that now would talk about it. And then I was getting more referrals because people were seeing my smile. So I was getting all these benefits. So even if I made zero on it, it wasn't a big deal, right? But we need to make money.